Hello everyone. I am Nisha, head for TS Mishra Medical College under AMSA India. We are having this webinar on the state level under AMSA India. Here we have a beautiful speaker, Dr. Disha Dalela from the University of Massachusetts. And I would hereby invite Avika to introduce her as Avika got us the privilege to bring her here. Thank you so much, Avika. Please, you can.
Hello everyone, I hope I am audible. Good evening. Good evening one and all. Today I, Avika Shukla, along with my colleague Nisha Mishra from T.S. Mishra Medical College and Hospital, in association with Asian Medical Student Association, is here to organize a webinar on the topic For the Love of Medicine by Dr. Disha Dalela. Asia Medical Student Association is a peak representative organization for medical students from across Asia and beyond. Today we have special guests amongst us, Dr. Diwakar Dalela and Dr. Ava Dalela, one of the most renowned doctors in Northern India. Welcome sir, welcome ma'am. We are honored by your presence in this webinar today. The Dalelas are known for their intelligence and hard work throughout the state. They say intelligence runs in the family of the intelligence runs in the genes of the family. Now, I would like to speak a few words about Dr. Disha Dalela. I am blessed to have known her since my childhood, starting from the best school Amartya Girls College to doing her PG from the best college. She has always been the best throughout her life. Dr. Disha Dalela is not only excellent in her studies, but also all other areas, be it dancing, singing, blogging, vlogging, basketball, and trust me, the list goes on. Along with her excellence in all the fields of life, she is an amazing and a wonderful person. She cares deeply about the environment since she was a child. Now, I would like to share a small incident about her when I was a child. As a child, I saw her getting angry whenever people littered the roads. She literally used to stop and ask them to pick the pieces of garbage and throw them in the bin. I have grown to become something like her. Now, coming upon the education. Dr. Disha Dalela did her MBBS from BHU in 2015 with gold medal in surgery, silver in medicine, and honors in pharmacology. She was also the basketball co-captain for BHU girls basketball team and titled the best outgoing student of BHU 2015 and present actor. She has also been crowned as Miss Pulse at AIMS Delhi in 2012 and received national awards for excellence in literary activities. She was the literary chair for BHU MedPress Elixir 2015. She has also been an active member of PETA and participated in activities for protection of animal rights. She then completed her internship from her hometown, that is Lucknow, as KGM. After completion of her internship, she moved to USA to complete the rest of her training. She went to Yale as postdoctoral scholar and did her research at cancer, genetics, particularly breast and lung cancer. She worked in the lab of the director of Yale Cancer Biology Institute and Slough Cancer Genetics Clinic. She was also involved in the research of epigenetics and she then applied for residency in internal medicine and matched into the University of Massachusetts, where she is now a second-year resident. She is still actively involved in research and plan on doing fellowship or DM in hematology or oncology, with special focus on AML and bone marrow transplant. The introduction itself spoke volume about Dr. Disha Dalela, and I am sure a lot of you present over here must have been inspired from her achievements. I would now like to present Dr. Disha to proceed further with her valuable words. Thank you.
Hi, everybody. Am I audible to everyone? Um,
Yes, ma'am.
Yes, ma'am.
okay,
Yes, ma'am.
perfect. Thank you so much. So, thank you, Avika and Nishta, for a very warm welcome. That was indeed very humbling. And I can see a lot of you have taken out the time this evening to chat with me. And I am very excited to see you all virtually, but also very reminiscent of when I was speaking with my seniors at some point. I would expect a lot out of that conversation. So my goal today would be to meet those expectations in whatever way is possible at this point of time. So the introduction is all behind us now, and thank you for that again. So let's dive right into what brings us here today. And I think the big picture is for the love of medicine, but the little picture is, how to go about from being a med student to being a resident, and so on and so forth. Um, so I have a few slides, and I thought the best way to go about this talk maybe to divide it into two parts. One would be to go off on the slides, and then the second part would be to have a Q&A session, because I realize a lot of you might have a lot of questions. So let's dive right in. I'm going to be sharing my screen. I have a few slides here, but not that they're supposed to be super formal or anything. I'm not sure if my screen's visible right now, but I'm hoping it is.
Yes, it
Um,
should.
okay, all right, sounds good. So, for the love of medicine, that's me, that's my institute where I'm at right now. So, I think the first part of this talk has to be about a little bit about laying the ground. So, all of you are med students at this point and kind of uncertain about where you are right now. But the first part of doing anything or achieving anything is accepting where you're at. And obviously, that acceptance will come once you have, reminded yourself that you have made it to a medical school and you are in an enviable yet a very difficult profession. For all you Marvel fans, the Spider Man dialogue with great power comes great responsibility. So, we are in this situation where we have a lot of power with the human body, and then we also have a lot of responsibility. So you have to believe in yourself that you are invested with this greatness and you will be worthy of it. You have to obviously pursue your goal, keeping in mind that yes, you are being an altruistic person, but you're also being a physician and learning and reading in the process. And of course, you have to choose your work over yourself every day, which is hard because as a med student, you are like 18, 19, 20, a young person. So it doesn't come naturally. But I think the one thing which steered me towards the right direction was loving what I was doing, really.
Ma'am, you got muted.
Nishtha?
Yeah, no,
Hello?
yeah, ma'am, you got muted.
No, no, I'm Ashanta.
Yeah.
Nishtha, like somebody muted, ma'am.
Oh,
Okay, that's all right. That's okay. I think we're. Is this
sorry,
okay?
ma'am.
That's all right. You guys still see my screen?
Yeah, we can see it.
Okay, sounds good. So yeah, that's pretty much laying the ground bit, and I might have lost you guys a little bit here, but the big picture being that you have to believe in yourself and love what you're doing. Um, then I guess a part of it is what puts aside a smart medical student. And then I want to dismiss the notion that you have to excel in all of your subjects. That wasn't true for me either. I wasn't stellar in, like, say, biochemistry or community medicine. Like, I would know enough to get me by, but I also might not. That wasn't really my forte. But I did what I did do practice consistently was observe what I was doing, observe my patients, understand them, and feel the rhythm of the human body. Because the more you are in sync with that, the more you realize that there's a pathology, there's something wrong, and then you want to investigate that further. Um, Another major part of what I feel a lot of us do not do, and we should probably do, is to connect and read together the systems. For instance, if you're reading pharmacology and if you're trying to read the cardiovascular system, it might be prudent to like connect your pathology, to connect your medicine at the same point of time, so that you have a big picture laid out in front of you all at once. When I was going through med school, I wasn't empowered with a book called First Aid. I did read that for my preparation for USMLE, but I would highly recommend all of you to use that as a skeleton, because what it does is it breaks the whole of medicine, or the whole of actually the whole curriculum, into systems, and you can finish anatomy, physiology, pharmacology, pathology of everything together and retain that for longer. And then, of course, teaching somebody will get you a long way, because then you can retain longer. And of course, the bottom line of everything is never forget that common sense. You should not lose the sight of the forest for the tree, which, what I'm implying here is that even if you go into the depth of something, you should not forget the big picture. And I think that really helps you be a smart medical student. You have to have fun. You're technically in college. So, I had a lot of good times. I had my amazing friends who I used to eat out with plenty of time. I was heavily into reading novels and books that I liked. And of course, I did do well in a few things, but the flavor of that victory would have been not so great if I didn't have amazing friends to share it with. Um, and then a big part of why medicine. Why did I choose medicine versus why I can help you maybe decide if you want medicine. So I have a bunch of points here, but really I don't have to go off all of those. The big part of reason why I think medicine is such a great subject is because it unifies everything that you've read so far. There's a ginormous diversity of cases which no other subspecialty allows. And you're basically touching upon surgery, upon ophthalmology, like everything is unified by a physician. And I think that is a great power to be invested with. There's obviously a diagnostic challenge, and with all my due respect to Dr. Gregory House, I think we all realize and feel that medicine is very intriguing because of that challenge. You learn intricate management of patients, and in that process, you develop longitudinal relationships, which is rewarding at the end of the day. And then the research and exploration bit, I'll come to that a little while later. But then the next part is like, okay, so you like medicine, but you're not sure about what residency should you pursue, whether you want to go for medicine or something else. So I think the first cut off comes at a point of choosing whether you want to be a surgical versus a non-surgical resident, or a surgical versus non-surgical lifestyle. Once you've decided that, you should think about whether you enjoy diversity of cases or whether you enjoy doing the same thing over and over again. Reading and research is a big part of medicine, and I feel if you maybe do not enjoy reading, it could be a little hard to do a medicine residency because there's an immense lot of reading that comes along with it. But to me, that doesn't feel much because I enjoy it. So it really depends on you whether you want to keep up with that pace. The colleagues that you gain as part of your residency are also very diverse between specialties, as you would know, seeing your residents. And then a big part of it is what is the bread and butter of the residency or the lifestyle that you're choosing as part of that residency moving forward, and whether you like it or not. Because if you don't like doing the bread and butter part, you probably won't be happy with it. There'll be a high burnout. And then the super or the subspecialization would also be dependent on the bread and butter of that particular field and whether you want to keep doing it or not.
Ma'am, you're muted again. Whoever's doing it, please stop it. It's not a good act.
All right. Is this good now?
Yes, ma'am.
Okay, don't worry about it. This is fine. Okay. So basically, why did I choose medicine is because I have the ability to do what I want and work the way I want, and then also come back home to things or people that I love and want to be around. Um, so then the part of the big question or the elephant in the room is the pros and cons of doing residency in India. The pros being that, and you all are probably privy to that already, that you have a strength in numbers. There's a ginormous patient population. You see a lot of pathology, which I do not believe any other country lets you see. That kind of training is indispensable. You're accustomed to dealing with a large volume and a large variety of people. As you are doing your residency, you're working your way up the system, you're making connections. So, if you want to be in a leadership role, being a resident in that system allows you to climb that system pretty effortlessly. The other part is the hands-on training in India is immense and extremely enviable for residents from other countries. So while you're doing it, it might seem like there's a lot of work that goes into it, but at the same time, it really gives you the experience which nothing else can do. There's an element of social service that you can do along with your residency. And I, for one, didn't do residency in India, but as a med student, was fortunate enough to go to a village along with my in-laws in rural Maharashtra, where I could spend some time with this group of girls, which you can always, plan along with your residency, and it's very rewarding. The food in India, of course, something that I miss every day, and the exquisite places and the family, of course. And I'm not even getting into the psychosocial part of it all. Being with your family is a big part of it, but I'm just trying to focus on the objective parameters here. The next part is, not the bright side, and not the bright side. This is a picture of, my husband who did his residency in India, and I asked his permission if I could use it. He said, okay. With the point being that you could be exhausted with the patient load. You could be juggling between situations and people and the patients, and that could really be a huge strain on you. I have by no means done residency myself, but have lived it peripherally through my husband, through my parents, and through my friends who are currently residents in India. There is a lack of resources and research which might or might not get to you. And then slightly poor ergonomics where you're really not doing what you're supposed to do. You're investing a lot of time and effort in things that could have been taken care of by somebody else. That said, I still, like I said, I haven't done residency in India, so I can't speak heavily to that. But I can come to medicine in States, and the bright side that I have had for it. Uh, a big part of the selection process is that there's no single exam. So in India, you would, on one fine day, getting a rank and getting into a program, but that's really not the case here. And you're taking step one, step two CS, you're doing a selection, you're doing an interview process, and it's a pretty rigorous, prolonged process. Which of course could be great because then you're judged on multiple parameters, but also not great if you're willing to get something done immediately. You meet colleagues from across the world and you learn about different cultures because no single culture is perfect, and you want to be a sponge and you want to absorb everything that you think is nice. And being here allows me to do that, I feel, in several ways. Um, I want to do a HEMONG fellowship, and I really am allowed time to pursue research and have strong mentorship for that ultimate goal. And my program is also clinically heavy, but we also have dedicated time periods like an elective or a research elective where I could do what I want to do. More often than not, it's a calm and friendly environment to work in, and there's minimal normal scut work in at least my program, there are different sorts of residencies throughout the states, and they could have different amounts or levels of scut work. And I can't speak to them because I haven't worked in any of the other systems. But that really is, a little bit about my program and then an overarching statement of how I see medicine in states. Then again, not the bright side, and that's a picture of my mom, and then we're hanging on a video call because that really becomes your reality. Is that you're a person on the internet more often than not, and of course, you're learning a new system. There is a language, there is a cultural barrier which you're up against almost every day, and especially when you're seeing patients in the clinic, you might not realize it, but you find it difficult to communicate with them about your expectations because they come from a very different upbringing. The hands-on training is much lesser than what it is in India, but at the same time, in the same process, I feel it's kind of good ergonomics because then I'm not made to do things that somebody else could have done for me, and I can only focus on the mind work part of it. The legal system or the insurance system dictates a lot of decision making and management. Like it or not, your hands are tied by what is legally and insurance wise permitted, which is a difficult transition to be getting into because you haven't done any of that in India, and you're like suddenly up against this whole giant of the legality of medicine. The visas and selection process is something which I can talk more about once the Q&A session is up. But that really is everything that I got, and I'm happy to chat with you guys about what questions you might have, and then take it from there. So I'm gonna, this open house, anybody can pitch in, and I'm happy to address. I do have some of my videos. All right, so I got one question here. Sorry, I'm just looking at the chat now, and all right, yeah, my pager did go off. Yes. So when do you suggest we take step one is the first question from Akshay. So step one, I would suggest that if you can take it in your third year of medical school, that is maybe a good time because you're fresh with your basic subjects of like anatomy, physiology, pharmacology, pathology. That said, if you haven't thought about USMLE even then, looking back, I feel I had a much better understanding of these subjects as a final year student or maybe in my internship because you look at it from that angle. Okay, so you have taken step one, or okay, so I see that you have been using Kaplan ever since lockdown began, which is great. I mean, if you can take step one right away, as soon as you're done with the second year, that probably is going to get one thing out of the window. I will say that increasingly, or rather not increasingly, but there's been a change where they are allowing students one pass or fail to apply for the residency programs. For foreign grads, I don't think those things will be as as easy. So I would still say that give it a good prep time, and then try and goal focus course. So I did my college from Banaras Hindu University. I was a batch of 2011. Okay, and then back to if you don't feel prepped. So Kaplan is great for step one, but like I mentioned earlier in my talk, is that First Aid is a great book for helping you put down a lot of things together, and I think that's the backbone for step one. And then doing the U World questions maybe once, maybe twice. By the time I took step one, I done it 3 times all over. So try doing that. That should help you get prepped and take some mock exams while you're at it. All right, Manya has a question. When to choose to go for observerships and or electives, and how did I go about these? So I think a good time to do these would be when you're doing your internship. So when I say internship, there are two different things because in the States, when you say internship, it's your first year. In India, internship means right after your final year. The internship interruption could be a big problem for a lot of you and between a lot of colleges. I was fortunate that that was managed pretty well at my end. Um, so that is a good time because when you go for these observerships and electives, you don't want to sound like an idiot. You want to know what you're talking about. So if you've done your final year, if you've done a bit of internship, you come to places in the States, people like that you have a good clinical judgment. They like that you have a good knowledge bank. And I would actually recommend taking your step one or even step two before you come for observerships or electives because that'll set you apart and that will create a long lasting impression because I think for me doing electives in my intern year allowed me to have a more impressionable rotation. So that's how I went about these, Mania. If you think that is not enough of an answer, feel free to like text again on this chat. And then Sumedha, you have what institution or study material you suggest. So like I said, um, First Aid as the book, Kaplan has their divided material for all the subjects, but I didn't really bank on them too much. I had read widely in my MBBS, and I would rather prefer my own notes from back then other than First Aid. Institution for USMLE prep, really none. Like, I don't think there is an institution that I can endorse or believe because I didn't go for one. So that would be my answer to you, Sumedha. Harsh, what would you suggest for a first year medical student? So what I would suggest for a first year medical student is um, read Grey's Anatomy, especially the student Grey's. I did not have that book for a long time, maybe had it towards the end of my first year, and it's a great book because that helps you understand anatomy, and then physiology and biochemistry really depends on your university and what kind of books they prefer. You really can't do a whole lot as a first year medical student. You can do a lot as a second year medical student for USMLE. As a first year student, just focus on knowing your basics. Just focus on understanding. And if understanding is hard, put things down together. Like if you're reading about the cardiovascular system in your anatomy, at that point, try and understand the physiology. The biochemistry could just be, hanging by itself in a separate zone. You might not be able to connect things there, but try and read things together and with friends. The more you discuss with people, the more you teach, the better you get. I remember, Harsh, that I was supposed to. I took almost like a brief class where I taught all of my colleagues about the talus bone, and people still remember me for like teaching about the talus bone. But it wasn't a big deal. But then I remembered everything about it. So I would suggest do that. Teach somebody and get your basics clear. Anmol, any offline resources for USMLE prep in India? For offline resources, like I mentioned, the books are a great thing. A lot of people, and I don't think that's really legal, have their UWorld questions like their like screenshots. I didn't use any of that. I pretty much were online most of the time. What I did do is that I got a PDF of all the tables that UWorld has, and I printed all those tables. And those tables were great because sometimes you just have to do a little bit of rote learning. It doesn't sound great, it doesn't sound smart, but you have to memorize a few things, especially like, for instance, when do you do antibiotic prophylaxis for infective endocarditis, right? You have to know what conditions, what are high risk conditions, what are the high risk people, all that stuff. So you can print these tables from UWorld and read them on the go, which is what I did. I had a few friends during my internship, and I would like sit down with them and chat with them, and we would discuss these tables. So that was useful. The other question from you, Harsh, is we are reviewing from UWorld and first step one in first year. Okay. that's pretty good if your college allows you to do that. But I will say that if you start doing a very exam focused reading right from your first year, you're never going to get a very good understanding. If you are the kind of person who understands better when you prepare for an exam, then you be you. But to me, I feel the people who kept wanting to crack PG right from the second year did not come across as people who really understood what was going on. They would know the tip of the iceberg. They would know a lot of tips of the iceberg, but they probably wouldn't know in depth of really anything. Um, but you be you. You decide what you want to do. Rashi, ma'am, how to enhance our CV? So enhancing your CV has a lot of dimensions to it. In India, we are unfortunately trained or brought up to believe that scores and ranks are everything. I did not think that was the case in my evaluation, and I think the one thing which got me a lot of great interviews and a great spot ultimately was my medical school performance evaluation, which in turn was based on the number and the variety of things that I had done. So for you, Rashi, if you're interested in medicine or if you're interested in, say, cardiology, try looking out for workshops or like conferences or poster presentations or abstracts or research papers. And I know that's all easier said than done because I struggle with that too because there's nobody guiding you. It's hard as it is. But as a second year and third year medical student, if you can get your hands wet with at least some sort of a research project, that would look great on your CV. Even social work, like for instance, if you're still interested in say cardiology and you decide to hold a workshop on blood pressure management for people aged between 40 to 60. You just collect people and you give them a talk or you do like a Nukkar Natak and you educate them on that looks great on your CV too. I did volunteering at an animal shelter before I came here, and I felt I was asked about that quite often too. So it really wasn't about, how many gold medals or silver medals did I get. Yes, that looks great, but nobody really asked me about those things in my interviews. I hope that answers your question. There are a lot of things that you can do to enhance your CV, but those are a few. And then Eshanka, what is the selection ratio in USMLE and is it really time consuming as said by many? Yes. So yes, I'm not going to fudge around and say, no, this is not time consuming. It is fun. Sometimes it's not fun. Your patience runs dry and you don't know why you are doing this because, your friends and your colleagues are, banging out the residency and they're almost done with everything and you're still stuck preparing for step one. So it's frustrating and prolonged. But the good part is that um, it's not a single exam which is deciding how good you are. It is a fair assessment in that way that there are multiple exams as an interview process. So you're evaluated by a lot of people. The selection ratio in USMLE is becoming extremely difficult to comment on. The political scenario will determine a few things in future. It has become hard to get visas recently, but I don't think that is something which is permanent, and I wouldn't give or take away hope from you, but I also won't know how to comment on that because that's a very dynamic equation. All right, I got a thank you from Manya. And then Pranita, what is the income difference between India and States? So to be fair, that depends on where you're doing residency. So I can't comment on attending salary because obviously I'm not attending yet. But as a resident, you would earn somewhere between 50 to 60K per annum, which comes about to like $3,000 per month, out of which you are spending about $2,000 in your like living and eating or whatever. So I would say that you probably earn more as a resident in India, especially if you're doing residency from a central institute. But you don't really realize all those things here because I think you have a decent quality of life, even if you're not earning a ton. There's really not a lot of saving that you do as a resident in States. That I can say because I know that a lot of residents in India are able to sustain families and such. I don't think that is extremely possible here. But people manage, and it could just be me, but that's how I see it. Um, Abhinav, we should apply directly after internship if we have done clinical electives, or we should have 1 year of research training after internship, and taking break and extending our internship for electives will be of course absolutely. So Abhinav, that's a great point, and I cannot emphasize enough um, on giving yourself some time to build on skills that you probably might not have during your training in India. So if you get an opportunity to train in a research place or like do a period of research here, that will go a very long way because you're not only thinking about doing residency, you're also thinking about um, doing a fellowship and so on and so forth. And then whatever you do adds a lot of just makes your CV look great for residency, but also makes you an intelligent person because moving forward, medicine is going to be a lot about data and interpreting it. If you don't have experience, you could be lost and you might be struggling with that for a while. If you have to extend your internship for electives, that is absolutely worth it because the word of mouth goes a long way here because people will trust a person who has come here before than take an absolute stranger. Even if your scores are in 270s, you are not going to be evaluated if people don't like you as a person. So if you do electives, they know you, you have letters from people here in States, and they're willing to believe that this is a good person. Yes, Harsh, first aid has great diagrams. Akshay, how competitive is ortho? I mean, really, how competitive for IMGs? I think it's fairly competitive. I haven't had any colleague, I mean, as a foreign grad who's applied to ortho. I would imagine it's fairly competitive, but the data would be out there. I honestly don't know how tough is it. Um, yep, if you're teaching other in hostels, that's great. Okay, so Akshay, do you recommend specific books for year 2 subjects? So for pathology, I recommend Robbins through and through. It's a great book. Nothing gives you a better concept than Robbins itself. People do a lot of pathoma for USMLE. I think that is bullet points, and bullet points never stick until you've understood the whole story. So if you're just starting out your second year, I would highly recommend, taking the long road because it's worth it. But after you read a certain topic, make your own notes, and that should be helpful. Versus, you could always use a book which has made those notes for you off Robbins. For pharmacology, I we were doing KDT and I forget Sparsh Gupta, right? Sparsh Gupta was the book for pharmacology, which I would recommend. It was also a prep book, a lot of points. Uh, but I mean, to be fair, I did get honors in pharmacology, and I feel like a night before your exam, of your pharmacology exam, you need to know everything. A day before your viva, you need to know everything. And the only way you can read a book cover to cover, especially in pharmacology where your retentivity could be short lived, a book like Sparsh Gupta helps you achieve that. I remember reading the whole book before each exam, and I think that's why I did well, and it also just stuck for longer. It's a volatile subject. For biochemistry, I think we just did Anant Narayan, I believe. I don't remember at this point if I did any other book, but that really is all I have to say for second year subjects. Um, all right, Anmol ma'am, from 2019 batch in MBBS, we will have electives of 2 months after third year. Is it a good time for USCE in completing step 1 before? Yeah, I think it's a decent time. If that is built into your curriculum, that's fair. Like I said, if you're coming to an institute here, you want to know your subject, you want to know your basics. You don't want to just come here and just saunter around and not achieve much. So if you have an option of doing it after your final year, you would be a stellar student here, and you would just have a bigger fund of information and knowledge, which will set you apart. um, Step one, you can absolutely finish in that time period, right after your second year. Manya, we start with prep after second year or during second year side by side if you're planning to give step one after during third year. Okay, that sounds reasonable. Like I said, like you could have different strategies of doing that. I'm not going to dictate or guide or coach or teach a one way of doing this because there's never one way of doing anything. If that suits you, go ahead and do that. Uh, Pushkar, ma'am, please tell how to manage college exams and USMLE exam prep together. Yes, that's a great question. I would say that you focus on your college exams when you're in college. Essentially, in a way that, what I said before, if you are a first year or a second year medical student, you should not be reading, um, or at least that's what I think, you should not be reading PG oriented or USMLE stuff right off the bat, because that is bullet points, and bullet points do not help you to make an understanding. So at least for the first 2 years, I would highly recommend you to stick to your college exam prep and not think too heavily about USMLE. When you decide to take step one, about 4 months ahead of it, start like kind of building that into your college exam prep and see if that helps you. First aid you can use all along, but UWorld requires dedicated time, so you have to build that in with your college exam prep. If you're a third year or a fourth year student who wants to take who's not taken step one and plans to take it, I would just recommend be done with your college exams, get your third year and final year done, read as much medicine, as much surgery, as much whatever you want to read, and get your concepts clear, and then take an exam or in your internship, because you have a solid foundation. Because I feel the reason why I am able to do well even as a resident and set myself apart is because my knowledge bank from the rigorous amount of reading that we did in BHU is it sticks to me. It sticks to me way longer than a last day prep for an exam. Like I could remember weird things like Lemire syndrome or I forget right now, but those just come to me because I read them well when I was a med student and I didn't care to prepare for an exam, because it's kind of, you might think it's two different things, but if you're learning the right thing, the exam prep is going to be easier too. So that's how I see it. And there's more detailed information on my timeline video on YouTube by my alter ego Winged Healer. So feel free to use that as an anchor if you may. Vishal, how would you describe U.S. physicians' commitment to social responsibility? Oh my God, that's a very heavy question. So, social responsibility to people in the States, I think a lot of it is, like I said, driven by A, the physicians themselves, and B, by the legal system. So overall, what like an overarching statement to that would be that they they are committed to providing a great care for these people, but care coordination itself is nobody's responsibility, and it falls on the poor patient and becomes very hard to keep that boat sailing. And I could talk for hours on that matter because I face that situation quite a bit, but I also don't want to take away time from everything else. So I can, maybe close the loop on that in the end. Um, Shreya, how was it to adapt to the US medical system being an IMG from India? So I think it came as a shock. when I came to for my observership at Mount Sinai in New York, I was extremely unhappy, and I was very much alone and very much struggling. And I am not going to, like I said, I'm not going to be dishonest and say, oh, it was great and I was great at it from the word get go. I had a tough time understanding epic, understanding abbreviations, understanding how the system works. But I have been a good observer. I am not afraid to ask. So even like there were occasions where you're looked down upon because you're like asking stupid questions as to like, you know, like for instance, an acronym that they commonly use here is for coronary artery bypass graph, they'll say cabbage. And, I came in into a CCU and they were like, cabbage, cabbage. I'm like, what is happening? That even things like that just make you feel like you don't know anything. And then if I were to ask a question, they were like, well, we don't want observers asking questions right now. That all of that has happened. So it has been hard, but has that deterred me from what I want to know? No, because if people want to judge me based on that moment, it is their problem and not mine. If I have come here to learn something, I will learn that no matter what. And my goal of coming here was to be or is to be a very good physician and then eventually be a good hemoncologist, and whatever it takes, it takes. I will say slowly over the years it has become easier, but over the past 4 years that I've been here, each day I take back home something new, which is a learning curve. Uh, so, Akshay, you don't move to the US just for the money. So, I'm sure people who really want to settle down in the States will manage. So, it depends. I don't think I want to settle down in the States. So, that wasn't the motive for me either. I came here for the training because I was keen on research. I like the way things function here. I had a lot of family support in making that decision. If you want to settle down here, that obviously is a big motivation for a lot of people who come here. Absolutely, not for me so much. So, Eliza, James, have there been instances of racial discrimination per se? Any firsthand experience? Yeah, there have been instances, and especially, you're a tiny Asian woman who is compassionate and is nice, but people would still, not maybe not listen to you, especially with the nursing staff. They would take orders from a tall white man, not so much from you. And these things are openly discussed even in our institute. Like I'm talking out loud, and I do not fear judgment because that's the reality. But I will say racial discrimination here or in India actually even is not very different. In India, you could have like I was always you were a female doctor, you're always a nurse, you're always a sister G, you're never really a doctor. So that is not very different here. In that way, like you're just dealing with a form of discrimination there, another form of discrimination here. There's a lot of casteism in India. There's a lot of religion stuff happening, and I do not mean to allude to any of that, and I will not. But I'm just saying that the forms of discrimination are different, but they're about the same as they are in India. First-hand experience, yeah. Like I mentioned, my first-hand experience in Mount Sinai in New York was, uh, you know, um, I think a professor, and he was an Indian himself, who said that, do you even know what bleachers are, kind of thing, and that's happened. But like I said, I've never read too much into situations. It keeps my mind clear, um, so I don't remember too much of those experiences, and that shouldn't deter you if you're interested. That shouldn't be your reason not to pursue this. Akshay, what about micro? So for micro, I think we did Satyanarayan. No, wait, Anant Narayan. And I really only did that book. Some people did other books, and I might have alluded to it before. I was not a great fan of microbiology. I just kind of did what I had to for the sake of the exam. So it's long behind me. I did end up revising micro through first aid, whatever little information it had, because ultimately I was only going to retain as much So that's my, you know, not so intelligent, but just about it talk on micro. Abhinav, if I do research in gastro, then will that help in getting residency in medicine or research? No. So, absolutely. If you want to do research in gastro, go for it. It will help you get residency in medicine by all means. I did research in oncology. I did research specifically in lab on lung cancer and then clinical research with breast cancer, and that helped me a lot because that helps me not just for residency but also for my fellowship eventually. Uh, Rashi, ma'am, revising is a bigger challenge for me. I struggle with preparing a plan to revise the topics that I learned long back. Still not able to figure out how I plan my studies in a way where I can give enough time for revising the old topics. So I think the revision part of almost everything comes down to the amount of effort you have spent on shrinking the size of your reading in the first go. And that's what I said. When you're reading Robbins, the first time you're reading a chapter, it is your responsibility to synthesize maybe a 2-sheet summary of what you read over 20 pages. I did that for the whole leukemia, lymphoma, the white cell and the red cell. I made my own little tiny booklet of information which I would access, and that was enough. Versus you could use one of those summary books. I'm not a great fan of those books, but people say that revising through those books helps you be done with it quicker. um, and you could always have your own strategy around it, where if you're reading pharmacology, say, and you're reading Sparsh Gupta, I think that was one of the only books that I would recommend as a smaller book, but you could have other books that help you revise the old topics quickly. um, Abhilasha, how often do people get selected for fellowships in case they did take and clear steps but chose to do their PG in India? And in such cases, any electives observerships needed again to stay relevant. So yeah, it's hard because most fellowships require residency from ACGME accredited programs, and ACGME accreditation comes only when you do your residency in the States. And I don't think you have very many options of doing fellowships if you did your PG in India. You do have some fellowships which are not very hands-on, A. B, they don't let you practice in the States. They will make you come here, see stuff, and then you got to go back. So if you are looking into just getting a short-term, training, a brief stint at it, that might work for you, but it is not the best recommendation that I would give to somebody who's interested in doing more in the States. Uh, Rashi, which is better, USMLE or the MCCQE? I have no idea. I have not done the MCCQE. Also, don't have any friends who've done it. So whatever I say could be entirely wrong. So if I do find out about it, I'll post it, but I don't know at this point. Or PLAB. PLAB, I have had a few of my colleagues prepare for it. I think PLAB allows you a little more flexibility on doing it after your residency. You could do your MRCS or the counterpart for medicine. But I think that's a decent choice, and it depends on A, if you want to settle down in a foreign country, and B, how much time are you willing to dedicate to your training. Akshay, thank you for that compliment. I will take it. Ishana, I've heard there are overseas volunteering or fellowship opportunities provided and funded by some residency programs for their fellow residents. Is it true? Yeah, that is true. So, for instance, the residency program at Mayo Clinic allows for global electives. So when I interviewed there for my residency, they did help us understand if we wanted to do something more globally, we can do that. We have a resident here who works for a news network, and I think she's interested in doing a global fellowship kind of thing too. So there are programs that do that. Do I know all of them right off the bat? No. But if I were to look into those opportunities, there would be there. Uh, Anmol, foundational books in first and second year, can you give subject-wise recommendation for it? So anatomy, Grey's Anatomy is it's absolute gold. So go for that. And then for physiology, I did Guyton and Ganong based on whatever topics I couldn't understand from one, I did the other. But physiology is hard and it's hard to memorize. It's easier to understand. So I think there is that fine balance which you will need to strike with your own sense of reading and judgment on how you can achieve that with biochemistry. I don't think I have a great book, but I did the Lange publications, biochemistry, which was great, and I enjoyed reading that quite a bit. I forget the name, but it was the Lange publications for biochemistry. They had a very simplified way of explaining everything, stuff that would stick. For the exam per se, I think we were compelled, well, not really compelled, but we did Satyanarayan a bit more. Also, how to apply for USCE while pursuing your MBBS. So you have to figure that out with your college. I did mine in my intern year, and my internship was interrupted because of that. Some colleges have it inbuilt, like one of your friends mentioned that before. So if you can, then you have to like interrupt and probably have a bit of an extension later on. So it depends on what college you come from. Abhinav, publications are absolutely helpful for getting selected in USMLE. I cannot speak enough to how much that goes a long way. And not just for looking great on your CV, but making you a well rounded physician, because I am a strong advocate for not believing what others tell me until I read for my own the evidence or the data behind it. And the more you publish, the more you know, or the more you understand what other people have been doing, and the better you get at practicing real medicine. And Akshay, how important is what you did back in school for the USMLE resume? So I wouldn't hang my hat on how important it is, like saying one way or the other, because I did put down a few things from my school. I did put down, like, I was this child scientist, and you know, did got a pretty good score in my 10th and 12th. But that really is not very much, unless you're trying to say stuff like, you know, you were playing badminton at a national level in your school, or you were heavily into music or some sort of hobby which you've pursued to a great extent. So I did pursue music and violin for quite a bit, and that looks good on my resume. uh, but if you have been a well-rounded person in your school, you're free to like expand on it. But I think a bigger part of it starts when you're in med school and so on and so forth. I believe that was the last of the questions. Okay, thank you. Um, what is the most important factor for getting residency? Scores, CV, or networking? And I would say everything. I think definitely what is in your hands is your resume and your scores. So work hard. Like I say, the overarching statement for everything is one day at a time. You have to make the best of the day you have in hand, and then use that opportunity for building on either the score or the resume. And networking comes with time. The more you observe people, the better you get at it. So no pressure on that. You'll be fine once you decide to go into this. Is telehealth good for LOR? Absolutely. I think it's fine. Things are changing. I don't know much information on telehealth, but sure. I mean, if you might be telling me in a month that it was great for the LORs. Um, Fifth or sixth, Daniels, do you have any tips related to managing studies for the step one and studies for college for fifth or sixth medical students, since their classes and shifts at the hospital? Yeah, so for your classes and shifts at the hospital, you have to have something on the go. You have to have people, you have to have your material, sorry, that you can read on the go, and what you're seeing at that point of time. Like, for instance, if you are seeing a patient with pulmonary hypertension tonight in your evening class, make sure you know the pharmacology, the pathology, the medicine, the management, everything about pulmonary hypertension that night. Never leave it to the next day, because who knows when you will see your next patient with pulmonary hypertension. But then if you get it on your exam, you would have aced it. And then Abhinav, how much is extra co-curricular part? It's extremely important. Like I say, I each of my interviews, my interviewers would say that, oh, so you're the best outgoing student of your class. I think that was because I was the captain of the basketball team. I was doing, like Miss Alexer stuff, and I was doing a lot of extracurricular, and that weighed heavily for my resume and for my applications in general. So go for it. Like the more rounded person you are, the better it is for you, for your own quality of life, and for your resume. So it looks good on paper. It looks good for you. So keep that ball rolling. All right. I think we're all set. I will pass it back to Avika and or so yes, I did manage all this multitasking, and Shreya, I like to give the entire credit to my mom for that, because even as a child, she took me to all these different classes for music and basketball, and she made sure I was doing everything. So I had that going, and Avika knows that from my Lamatnia days. So I'm thankful to my mom for like teaching me how to manage everything together. Avika, back to you and Arnishta.
So this was a really amazing webinar. Whatever you told us was really, really helpful. You not only told us about the basic books of like first year MBBS students, you also told us from the first year to USM, you told us everything. You covered the first year, second year, co-curriculars, extracurriculars, told us about everything, which was truly amazing. Not a single part of today's webinar was boring or to be skipped. The questions asked were also wonderful, and they were even wonderfully answered. So I'd like to thank you for giving your valuable time today. And the webinar would not be complete till we hear a few words from Dr. Diwakar Dalela. So, sir, I would now request you to speak a few words. Thank you.
I'm not sure.
Am I audible?
Hello,
Yeah. Hello, sir.
am I audible?
Thank you so much for joining us today. We are really
Thank you.
obliged by your presence today. Thank you so much.
Thank you, Avika, for asking me to be here. And it was a lot of learning for my own daughter on these ways, how to go ahead in the future planning in medicine. As I can see, most of you are MBBS students and pursuing a medical career in India. And I would be telling you what I have often told my undergraduate students. That as a doctor, you are a complete packet of mind, body, and soul. And doctors have to have first some qualities in their mind. The mind is, of course, it has to be intelligent mind, and you are all intelligent. That's how you made it to medical school. But you also be another eye in the mind, and this is intuitive mind. If you have intuitive mind, you're trying to dig everything that you observe in your day-to-day life. And thirdly, you have to have an innovative mind, because when you ask questions yourself, when you are intriguing kind of personality, you start thinking of solutions. So as a doctor, you will require to find a solution to every problem that you see in future. So for your mind, I rate these three qualities most important: intelligent, intuitive, and innovative. For the body of the doctor, let me tell you that our profession is such which infuses huge confidence in the patient by the way we look, by the way we walk, by the way we talk. We cannot afford to be dressed clumsy. We don't, afford to be sort of looking unpresentable. We can't be smelling of smoke and telling the patient don't smoke. So our body is very, very vital. So mind is vital, body is very vital, and finally the soul of the person is also very vital. We as a doctor have to be very, very sort of compassionate for our patients all the time. Compassion is one quality which every patient appreciates in the doctor. You cannot be rude. You have to be very, very compassionate, very, very considering for the patient. And you must always remember that when you become a doctor, wherever you become a doctor, India, abroad, ultimately it is the divine blessing on you. The God has made you a physician to treat human beings. So you have to remember this always. If you don't do justice to your job, the divine power will take it back from you any day, anytime. So be very truthful to yourself. Be very, very sort of every day when you sleep in the night, you should thank the Almighty and you should be so satisfied in yourself that you're doing a good job. So you will love yourself, you love your profession, you love your science, and more you love yourself, more you love your science, more you love your profession, better you deliver to your patients. That's what she's talking about, loving the medicine.
Mhm.
So ultimately, you have to love the profession, then you will deliver the best. So thank you very much for asking me what I have to talk about this. So, and I'm sure I'm not taking the question answer session. So thank you, Vika and Nisha here.
Thank you so much, sir, for coming and
Okay.
giving your valuable words to us. Thank you so much. Thank you, Dee, for your valuable words and advices. We're actually
Uh,
blessed here today.
I would now, uh, I would now like to invite Ashanka Singh, the state head for AMSA India, to for the vote of thanks. Oh, ma'am.
Hi, Nishtha. Am I audible?
Yeah, you're audible.
Okay. Hello and good evening to one and all. I am Ishyanka Singh, the state head of Uttar Pradesh, AMSA India. On the behalf of whole AMSA Uttar Pradesh team, I would like to thank our speaker, Dr. Disha Dalela, for taking out her precious time and consenting to be a speaker. Ma'am, indeed, your words have inspired all of us and cleared many of our doubts. Thanks a lot for coming up in this webinar, ma'am. And and thank you so much, sir, for taking out precious time to be present throughout our webinar.
I would now request all of you to please turn on your video so that we can take a screenshot for our memory. Sir, can you please also turn on your video?
Yeah, I think I'll just shoot him a text. Okay, there we go. I'm finally seeing your faces, guys. Hi. It almost feel like I was like, talking to a blank screen, but good to see you.
Yeah. Thank you so much for your valuable words. It was really one of the most interesting webinars that we've held to date. They were truly amazing. Thanks.
Thank you.
Thank you so much, ma'am, for your time. Thank you, sir, for being there with us.
Sir spoke like he spoke everything. He covered the entire topic, the love of medicine. He actually told how to love the profession and everything, which was great. So thank you both of you for coming today and enlightening us with the valuable words. And we're actually blessed to hear from you guys, the Dalelas, which are actually known for the. So thank you once again.
All right. Okay. Bye, everybody. Good luck. And I really appreciate all the thank yous. And I knew you were not robots, but thank you.
Thank you
Uh,
very much, ma'am.
okay. Bye, guys. Bye bye.
And thank you all the viewers for showing their interest in this webinar. And once again, I would like to thank everyone for making this program successful. Thank you.
Good job, Avika, Nishta.
Thank you,
Thank you
ma'am.
for organizing. Keep it going, okay? Bye.
Bye, ma'am. Guys, now we'll be sharing the link for the quiz on the group, and we can now leave the meeting, I guess.